All right, let's take you through how to get the most out of your tennis elbow brace. Now, you may have purchased this because you've got pain on the outside of your elbow, which we call tennis elbow or lateral epicondylitis, or you might be suffering from pain on the inside of your elbow, which is called golfer's elbow or medial epicondylitis. But this device is going to be able to help you with either or. So we're just going to take you through how to position it to get the most out of the pain relieving effects of this. With the condition called tennis elbow, what we have going on is the common extensor muscles that extend your forearm here, so they have the bulk of the muscle belly up here. It pulls on the bone of your humerus and it becomes extremely painful to the point that that actual spot right there becomes really tender to touch. What we're trying to achieve with the brace is to stop this muscle continually pulling on that bone to give it a chance to heal. So the idea of the brace is to be able to create a new fulcrum here so that this portion of the muscle doesn't work for a little bit. This portion continues to work so that you can continue to type away at the computer or grip a hold of your cup of tea or your tools or whatever, but it gives this opportunity here for this area here to be able to rest. Exactly the same for golfer's elbow, except we're placing the brace in a different way, but you're wanting to take that last inch and stop the muscle working so it stops pulling at that bone so that that bone can heal. Of course, we also recommend that you use bone aid relief cream and Chirofix on that area. And if you've got an ultrasound, put those two on first, then the gel, put it on, it will heal really quickly. This is what you need to wear when you just don't have a choice. You have to be at work, you have to stay on the tools, typing away at the computer, whatever it is that you need to do. And this will help to prevent further aggravation by using your hand at the time. So it's pretty simple. Nice and easy to use, Velcro. The Dr. Kez symbol is really helpful in this regard because that's where we need to place right over the top of the muscle to create that fulcrum. So slide her on, baby. We're literally trying to find that spot that's about an inch away from that tender bone, and we're putting the Dr. Kez logo right over the muscle and then tighten it as much as you can to not create tingling in your fingers. The last thing you want is to find that you've got no blood supply in your hand, okay? It needs to be tight and firm to stop this part of the muscle pulling, giving it a rest. But if you do it too tight and you lose sensation in your fingers, then that's not great either, okay? So there needs to be a happy medium in the middle. And when you've been using it for ages, let's say you've been on the tools or you've been typing heaps, you might find you need to tighten it as well. So that can happen over time because your muscles can swell, they can reduce in swelling, etc. So it is good to just note, how tight is it? Do I need to tighten it up? But that's how we do it for the lateral epicondylitis or tennis elbow. And then we do, I feel like a superhero. The opposite. Sorry, I'll swap spots with you. Excellent. So an inch away from that bone there is where we place the Dr. Kez emblem for golfer's elbow. And same thing, tighten it up. I always just use one of the straps to tighten it up. You can actually alter both, but when you're doing it by hand yourself, it's easier to just use one. And then that fulcrum part, because under there is where the pad lies to be able to prevent the rest of this muscle from activating. We want to give it a rest, and you want to make sure, as best you can, don't use it, but obviously there's certain circumstances where you have to keep working or you have to keep using your tools or changing your child's nappy or whatever it is that you're doing, and you have to wear it. So that's how you do it. And again, tight enough. Sorry, soldier on with. Yeah, okay. But not tight enough to cause a blood flow issue in your hand. That's really important. You want to be able to make sure that the blood's flowing back and forth as it should. So that is a tip on how to get the most out of your tennis elbow brace or golfer's elbow brace, depending on what you have. So,
Terminator.
Oh dear.
Anyone seen Terminator 2? Sorry.
Oh dear. Thanks for having us on your therapeutic journey.